We're going to be talking about the Storz setup tower system that we have here in clinic. There is a couple of different devices. We have the TV screen up top. We have the image where your camera goes into. We have our light source, and we have our endoflator. Now the endoflator is what we use in laparoscopic surgery to pump CO2 into the abdomen to kind of blow it up, so that way the tools can go in and you don't risk, puncturing anything. So you start by making sure everything's plugged in, and to turn on the endoflator, it's a switch and you just turn that on, and then it will power up. Now here on the endoflator, there is tubing that will go onto here that connects this to your patient. Now in order to make the endoflator work, if you go into this bottom drawer, there's a little wrench. And you go behind, there is some CO2 canisters, and you have to put the wrench here and spin to the left to open the CO2. And once you're done with this unit, you're gonna wanna spin to the right to make sure we close the CO2 to prevent any kind of accidents. We're just post-surgery here, so I'm just closing it up. There we go. Now, when you turn your endoflator on, it will let you know if you have enough CO2. Obviously the bottle's closed, so it's telling us there's not enough. But when it's open, it will indicate to you whether you have to change it. And now for our patients, because they are animals, we're going to be using the pediatric pressure. And there's pressure and there's flow. So the pressure is the amount of pressure in the abdomen, and the flow is how many liters per minute, how fast the CO2 is going in. Now for this, to change it, it's a touchscreen. You can press up and down. We generally keep our pressure at 10. And then for the flow, for smaller patients, like small dogs, Shih Tzus, or cats, I will keep it at a 2. But for larger patients, I'll go up to a 4. Now once you have everything on, the CO2 open, and this is hooked up to the patient, this is still not running. In order to make the CO2 run, you have to hit this button, and that will allow the CO2 to be expelled into your patient. And to turn it off, you hit that exact same button again, and it will turn off your CO2. That way during surgery, when they're saying CO2 on, CO2 off, it's this touchscreen button right here.